Hi, this is Dr. Bob Dannenhoffer. It's August the 14th, and this is our regular twice-a-week update on Facebook here. As usual, I try out new masks. This is a new mask made by the New Balance company. So New Balance, the company that also makes sneakers. And this smells distinctly like a sneaker insole that they have turned into a mask. It's actually pretty nice. So there's lots of different masks out there. So again, this is our Facebook Live, a chance for us to talk to people who are local here in Douglas County, who want to know what's going on. As you know, we take everybody's questions and we do it. On Tuesday, we had an unfortunate episode. I think what happened is we talked about that was made by a country east of Europe. So I'm not going to mention the two names because I think that is what brought it on. But when that question came in, and I think it was a very honest question, asking about the new from the country east of Europe, within a few minutes, we were up to about 20,000 views, and that's where all of these nasty comments came in. We had an opportunity to look at who put in those nasty comments, and they were overwhelmingly from people outside of the county, outside of the state, and even outside of the country. And we went back and looked at their Facebook things. You know, everybody's got cat pictures or grandkids on their Facebook. These had almost nothing, suggesting that they weren't really real people, or that they might even have been BOTS. So we're trying to not say these words because I think when you say those three words, country east of Europe or BOTS, what you're going to get is you're going to get a lot of things. So we definitely want to hear from local people. We do not want local people who have questions to get shouted down. So we're going to try and outfox the BOTS today. And the way we're going to do that is if you have a question or a comment, please put in the first part of the question or the comment something that only somebody in Douglas County would know, such as Jersey Lily has great frog burgers, or the river that runs through Roseburg is the, I'm not going to say it because anybody who knows it knows that. So put that in there as a little comment to start first, and then ask your questions and we'll go through it. We'll be a little slower tonight because it'll be slower for you to enter your comments, and it'll be slower for us to pick them up. But I think this is the way we're going to outfox those people in the rest of the world who are looking to silence your voices. Now, you know, there are a lot of people who disagree with what I say, and I have no trouble with disagreement. I have absolutely no trouble. I have trouble with incivility, where people write ridiculous things or where people try to shout each other down. So be kind. We'll see how this works. I'm not sure if it's going to work, but peace, love, and a vaccine. So let me tell you where we're at. So in the world, actually I have some really pretty good news today. In the world, the cases are kind of flat. Deaths are slightly up, but less up than they've been in the past. Still an active outbreak in the U.S., Brazil, and India, and really all of those other countries in South America. It really is truly remarkable how many cases there are in Colombia, Peru, and Argentina. So really still a very active pandemic. In the U.S., daily cases are slightly down, although they remain pretty high. So slightly down from the peak, but they've been remained at about 50,000 a day over the last 3 weeks. The death toll, which had been climbing, is now also flattened. So this is overall for the U.S. good news. Now we need to bring the case rate way down to consider this under control, but the first part of bringing it way down is stabilizing it, and I believe we have. Still a lot of cases in California, Texas, Florida. We're also starting to see a lot of cases in North Carolina, Tennessee, Mississippi, Missouri, and in Indiana. And this is a worry because these were places in the past that didn't have a lot of disease, and have really started to have lots and lots of disease. In Oregon, we're about 22,000 cases and 387 deaths. I think Oregon is also starting to trend down. I think we peaked on about July the 19th, and we're slightly down since then. Most of the cases in Oregon are in that area in Marion, Washington, Multnomah County, but then also in Pendleton, Ontario, Jefferson County, just north of Bend, and so we're starting to see lots of cases there. Douglas County, we're at 160 cases. 144 of those are confirmed. 16 are still presumptive. 25 people are in isolation, and that really correlates with active cases. And again, if you take 160 minus 25 and get that 135 would be the cases that previously would have been recovered. For every time we have a case, and so there's 25 active cases, we tend to have 4 or 5 or 6 contacts. And so we have 121 people now who are quarantining because they were a contact of one of our active cases. In the last week, we've only had 11 cases. That gets us under the 10 per 100,000, which would allow schools to open. So to allow schools to open, you need 3 metrics. One is the county rate less than 10 in 100,000. We're there this week. We haven't been there before, but we're there this week. Under 5% positivity rate, we're under 2%, and a state positivity rate of less than 5%. The state positivity rate is still a little high, but I'm very hopeful that we can maintain this good progress over the next few weeks, that schools in Douglas County could open. There's no place in the state yet that they could open because the state rate is over 5%, but we're one of the lowest rates in the state, and thank you, thank you, thank you. When we look at our new cases, we see a few things. The first is most are still tied to travel. People go to other states where there's lots of disease, they pick it up and bring it back, or people from other states where there's lots of disease come to Douglas County and bring it to Douglas County. Now people say, well, why don't we do testing? Actually, testing would not have picked up most of these cases because most of these cases people came back in an asymptomatic and likely negative testing scenario, so it wouldn't have prevented these cases. Really what we need to do is just be very, very careful about travel. If you are going to travel, try and quarantine either before or after you get back. In testing, we're continuing to do testing. The turnaround time is much improved. Remember, there was a time here where we had a week or more to get the test back. We're now down to just a few days. For example, all the tests that we did on Tuesday were back already by this morning. That is so great because when it's so long like that, it is maddening for the poor patient to wait on the test results and hard for us because then if they are positive, then it takes a long time to get it back. So again, if you have questions or comments, remember, start with something that only somebody from Douglas County would know, like Jersey Lily has great frog burgers or something like that. So it'll be interesting to see what people have. A couple of other studies that came out. One is that a study in Oregon of 900 people found out about 1% of the state has antibodies. 4.2 million people in the state. So that would suggest that 42,000 people in the state have antibodies. Since we found about 22,000 cases, that's about right. You're not going to find every case. There are some people who choose not to get tested or get tested too early or too late. And then a lot of asymptomatic people. So finding 22 out of the 42,000 cases suggests that Oregon is doing a good job at case finding. In other places where they've looked at it, the case finding is terrible. You look at the antibody level and you look at the number of cases, they're only finding 1 out of 5 or 1 out of 6 cases. But with Oregon finding 1 out of every 2 cases, that's actually, we're doing a pretty good job. So this is the problem. The problem is we're doing a good job and people say, what's the big deal? Only one person has died. We only have 2 people in the hospital. I don't know anybody who's even had it. And that's because we're doing such a good job. If we were, I looked at our county and I said, well, let's say we were in a different place, what would it look like? And so I put this together, if we were in a different place, we were the same, but had the average amount of disease in the U.S., we'd have 50 deaths. We'd have almost 2,000 cases. And so that if we had 2,000 cases and 50 deaths, everybody would know somebody who was sick and most people would know somebody who died. And so we have got this conundrum. When you do well, people said, oh, it's not such a big deal. But if you did badly, then people said, such a big deal, why'd you do a better deal? So it's hard. But this is a real disease. I mean, you don't have to, if you talk to people in other states where the disease is rampant, it really, really is a big deal. Okay, so one of the questions we got is, does rain wash the virus off surfaces? So rain or any kind of liquid dilutes the virus. But again, we don't think surfaces is a big risk for getting the disease. I think what we're seeing now more that droplets are still the predominant way, but that there's some aerosol transmission. So they did a study where they put these little virus collectors in a room where somebody had COVID, and they put these virus collectors right next to the bed, 7 feet away, 12 feet away. And even some of the collectors 7 and 12 feet away did have some virus in it. So we think that this virus is transmitted by droplets and even maybe somewhat by aerosol, But I think the data is coming more and more that we have to worry less about surfaces. But washing certainly does help. So washing anything dilutes out the number of viruses, and dilution is sometimes the solution to pollution. So is the mask... Okay, here was a comment. We miss our half shell, right? Only somebody from Douglas County would know that. I really do too. The half shell is great. Is that mask good for sports? That's what they sell it for. I'm not sure it's going to be good for sports. I'll try it tomorrow in spin class. So my dentist is in Harvard, clearly somebody who's from that. Can I speak about the recent cases of the VA? I can't speak specifically about the case of the VA, but like many outbreaks, travel to another area where there is disease. Somebody then comes back to Douglas County, finds out that they were infected, and by that time has already infected people at work. So again, be really careful about travel. My recommendation, if you're traveling to anywhere somebody else has the disease, take another week or two if you can and work at home so you don't bring it back to your workers. Because we've seen this again and again. People go somewhere else, they get infected, they don't really know they're sick, and they come back, go to work for a few days, and expose lots of other people. So do you think we're going to go back to phase one? Absolutely not. In fact, I'm hoping that we get to a point where we open schools. Malheur County did go back, but Malheur County has really struggled. All of Idaho has had a lot of cases. And you know, Ontario and Idaho share lots of things. And then it's now come over to Malheur. Big outbreak at Snake River Correctional. And so they're going back to phase one, but I don't see that happening to us. So Desiree says, what about the new research showing that neck gaiters may be worse than no mask? So I actually read the whole study from Duke, and that's not exactly what they said. What they said was that some of the very sheer gaiters broke down the big goobers that come out of your mouth into little goobers that might travel further than big ones. So again, what happens is when we talk or breathe, you have some little droplets and some big droplets. The big droplets go right down. The smaller droplets go further out, and the smaller droplets go further still. And that was the concern about the very sheer neck gaiters, is that the very sheer neck gaiters may have actually broken the big droplets, the small droplets, and may have been worse. Although, when they asked the people who did the study, said, that's not what we meant. So we still don't know. Still, any face covering, I think, is better than none. But again, if you're going to use it, I would use like the gaiters that my wife does, which is a gaiter has a mask behind it. Sally said, should I reschedule my annual teeth cleaning? So again, remember, there's all kinds of different risk acceptance. So, if you're really paranoid, you can probably wait another 6 months to get your teeth cleaned and just brush really hard. I did my dental cleaning. My dentist had all of the precautions. I thought the risk was very small, so I had mine done. Would my mom have it done? I don't know. And so this is one of those things where it's not a zero risk, but relatively low risk, and you have to figure out what your risk tolerance is. But I did mine. Pete's driving. So somebody likes Pete's driving. You wouldn't know that. I don't think that those BOTS from that country east of Europe know that. So I see a Springfield school is using air purifiers in the classroom. Is that a good idea? So I don't know specifically what they're using. We do know that rooms that have better air circulation are probably better than places that don't. So one of the things that came out this week is, it's been weird. We haven't heard about any outbreaks at airports or on airplanes. And we really haven't. And why is that? Well, both airports and airplanes have excellent air handling, and they have lots of air changes per hour. And we know that if you have more and more air changes per hour, the risk of transmitting disease is lower and lower. So you'd think that dang tube that you're sitting in the airplane would just be terrible. But because they're flying and they've got all the power in the world, they do have lots of air changes in the hour. And we've not seen a lot of cases on airplanes. Not the same for buses. We've seen a lot on buses, and China had an excellent study where there were a lot on trains. And so more air handling is good. On the air purifiers, you'd have to know about the specifics. I was talking with a school today, and they were having their HVAC people come in to find out about the air changes per hour. So more air changes would be great. If the air purifiers allow for more air changes, that's great. Yeah, so about new antivirals that sound better than remdesivir. And so you're right. So there could be antivirals that would be better than remdesivir. So remdesivir was not designed to treat this coronavirus. It was designed to treat Ebola. Didn't work, but then was tried against this. So it doesn't exactly, you wouldn't exactly think it should be perfect about this, but there are a bunch of other antivirals out there that they're trying. I don't know specifically about this 2811, but they're trying a bunch of different ones. And that's the real hope, is that they would hope happen on to an antiviral that would make this better. And we have some really good antivirals now. I mean, the antivirals for HIV are amazing. Right? Almost everybody can be brought down to a viral load of 0. The antivirals that we use for herpes are excellent. I mean, that can really treat this within a day or two. Antivirals for other things, for cytomegalovirus, are really excellent. And so there is certainly hope out there that an antiviral will come up. And that's the reason when people say, oh, just let it blow through. Well, if you let it blow through, you're going to have all these deaths that, you know, if in February this new one or one of the other antivirals comes out, you'll feel pretty silly about letting 500 or 600 Douglas County residents die because we were so impatient that we couldn't wait till January, February when there was either a good antiviral or a that would help people. So I love Rodeo Steakhouse. So do I. I think their rolls are incredible. Is it safe to send my granddaughter to kindergarten? And so this is a very tough one. This is another one where there's a risk tolerance issue. I think when there's a lot of disease in town, it is not safe to send a kid to school, because when there's a lot of disease in town, or a lot of disease around, what's going to happen is there are going to be outbreaks at school, and you'll not know how to handle them, and then the disease will spread in the community, and then it'll be out of control. But when there's a low level of disease, I think it could be safe to send your granddaughter to kindergarten. If you look at where kids are most likely to get infected, they're actually most likely to get infected from their parents, we think, rather than at school. And if you have a low incident of disease in the county, like we do here, the schools do a good job of separating and using masks. And then when there is an outbreak at school, that they carefully exclude that cohort. I think it is, like teeth cleaning, one of those low, moderate risk things. I certainly would never say there's zero risk, but it's certainly not a high risk. Now, high risk, yeah, indoor basketball games, really high risk. High risk, fraternity living, really high risk. I mean, I was in a fraternity and I remember it was like, we spread diseases when there weren't diseases around, so that's an issue. Now, sending your kid to your granddaughter to kindergarten, if you're taking care of them and you have some health issues, a little different, I think, than if you were 25 years old and perfectly healthy. But I think if you were 70s or 80s, underlying health conditions, taking care of your granddaughter, it may change that calculus a little bit. So kindergarten with a low rate of disease like we're going to have here, a low, moderate risk thing. Up. So we were at Umpqua Hot Springs. You'd only know that if you were here. And so are mostly out-of-state plates. Is that a concern? Yeah, out-of-state plates is a concern, right? Because people are coming from Washington, Idaho, or California, 3 states that have a lot of disease. I mean, it's kind of funny. If you look at the hotspot map, and there's a hotspot map where hotspots are in dark red, and then kind of hotspots are in light red, and, you know, we're in gray. I mean, we don't even have any color for most of Douglas County. For the Roseburg area, it's sort of a very light yellow. So, you know, these people are coming from other areas, come from high-risk areas. Now, if people are coming from the other area, camping in a solitary campground, hiking on a solitary trail, the risk is pretty low. However, the concern is that, you know, they stop at the same grocery store that you might, or the same restaurant that you might. So, you know, we're telling people if they're traveling from other areas, they should assume that they are infected and they should stay away from us. So I like Brick's Rooftop. I do too. I hope they open again soon. How long will it take to test negative for a person who has tested positive? This is a very complicated question. So the tests that most people are using are these RNA tests that look for the RNA in your nose. Now, there are a bunch of different tests you can use. You can use an antigen test that looks for the protein that's on the virus, or the most sophisticated test is a test that looks for a virus that can actually grow and presumably infect other people. So we know that for people who have, when you're looking for the virus that actually could be infectious, after 9 or 10 days, it's been really hard to culture, except for people who are very sick, like in the hospital on a ventilator. But for the typical person, after 9 or 10 days, that virus, in terms of culturing, will be gone. But that's a really hard test to do. So then we do these RNA tests, and these RNA tests look for RNA. The problem on that is that RNA can stick around in your nose for a very, very long time. We've seen weeks or months that it's stuck around in the nose. When people have tried to culture it, trying to get a virus that could actually infect anybody, they can't. But still the RNA is there and the test can be positive. We have described that as like bugs on the windshield. They were clearly alive at one time and could bite you, but now they're just a little vestige on your windshield. They can stick on your windshield a long time until you get your car washed. But we don't really know what they mean. And that's the problem with looking for negative tests. At one point, people were really into, oh, after you're positive, you have to have a negative test to come back to work or whatever. Nobody's recommending that anymore because of the complications. I mean, did somebody stay home for 6 months because they continue to have a positive RNA test, although there's no data that they would be infectious? So we've gotten away from the retesting. Fall Creek Falls, could there be anything better? So does the loss of taste and smell occur in regular flu? Really uncommonly. So, it's not something we've ever noted. And when you ask people, very few people can remember that. Now, a lot of people, when they get a cold or bad allergies, food just doesn't taste the same. But this is not what the people with the COVID are saying. They're saying it is a total loss of taste and smell. And it must be pretty significant. We had one fellow we were bringing food to, and it's like, this food tastes like nothing. And then one day he goes, oh my goodness, I could taste the Chinese food. And so the loss of taste and smell and the return of taste and smell is pretty abrupt in these people. Are you able to tell us if any of the 5 presumptives who were originally tested, the 5 presumptives from Mercy who were tested again and turned out to be positive? We don't think so. Now, there may still be some tests out there because we don't see the negative tests until the negative tests are resulted. So it's possible there are tests out there, but we don't think any of those presumptive tests are positive. So what in the world is that? We don't know. It could have been another disease that looked like COVID at the same time because there are other diseases that look just like COVID. So back in March, when we were just starting to do testing, there were a lot of sick people with what looked, I swore, was going to be COVID, and all the tests were negative. So there may be other viruses out there that look like COVID. In fact, this week in the clinic, we've heard a lot of people say, oh, I'm sick with fever and cough and a little shortness of breath. And it's like, oh, you should get tested. And most of them tested negative. So there's another virus out there that we don't exactly know where it is that's confusing us. So Clover says, and she likes Ford pond plans. Yeah, that'll be really neat, won't it? Why do folks say that masks are damaging lungs? I don't know. I mean, there's a lot of stuff out there which has no basis in science. And I don't know why people are spending so much time doing that. I think when I look at what happened Tuesday night, I think there are people who are just looking for disruption. There's some people who really have questions, and there are a lot of good questions. I mean, there was a great question about alternative therapies, and we went into in great detail. There's questions about, is the vaccine going to be safe enough? There's great questions about, are we doing too much of something and not enough of another? That kind of debate is great. There's just stuff out there for people who just want to disrupt. So how do you think about kids who were preschool and K3 going back in 2 weeks? I think I'm okay with that. If this is my grandkids, I think I would be fine with that. Again, we've only had one case in that whole age group, and that one case in that whole age group was from a family member. So I think it could be safe. And again, K3 is so important, right? It's possible that the vaccine or the therapeutic is going to be not until next summer. And if that's the case, missing a whole year for kids in the K3 is pretty tough. And so I think it's safe enough to go back. I think there's some states that are going back when they still have a tremendous amount of disease, and it hasn't been safe. But I think where we're at, I think it could be safe. So do face masks, probably face shields work as well as masks? Yeah, there's a lot of controversy about face shields. The problem with face shields is that almost all face shields were designed to protect the person who was wearing the face shield from stuff. So I wear a face shield in the shop because when I lay, there's stuff coming up at my face, or I'm using a drill press, there's little pieces of metal coming up. So generally, they are there to protect my face from moving objects, like a little shred of metal or a wood chip. And so that's very different. We're now talking about using face shields to project germs, which are tiny little droplets in the air, and that could go around the face shield. You know, a little piece of metal isn't going to come up here, oops, turn around, go this way, and then get in my eye. And so face shields were designed for a very different purpose. Face shields now are designed to protect my boogers from coming out to you and to protect germs from coming in. And there's not been that much data. Now, there is a guy who studies these from Iowa who think that face shields are better than face masks, but the data isn't there. And the CDC said without the data, we can't recommend face shields more than masks because there is data about masks. Oh, somebody likes Wildlife Safari. I would agree. I would agree. So somebody says, if you have a positive antibody test at Red Cross, does that count toward counting results? No. So we do look at all the antibody tests. And it's interesting, if you got one, I'd like to know if you could maybe do privately or something, because we have not seen that result. I gave blood last week, and I had a negative antibody test, it showed. It does not count, so we don't use antibody tests as counting towards the state total. So we probably undercount some tests, because if you have a positive antibody test, it means you probably had it. So when people said we're inflating the counts, we're probably not. We're probably undercounting, but we're doing it like we do for every other test, every other disease. So this guy, Joanne likes Sherms. I do too. I really like their produce section. So please talk about going back to the gym. Yeah, so about 2 weeks ago when cases were really increasing, the question is, well, geez, what else can we do to go ahead and bring the rate down? Because we don't want to bring people back to phase one. We don't want to close the borders. So what can we do? So they started having more restrictions. So the use of masks inside, the use of masks in gyms. And that has been problematic because I think it's hard to exercise with a mask, but you can exercise outdoors. We think face shields actually are appropriate in the gym. So I know I had that sort of silly Star Trooper one, but you could use face shields too if you were in the gym. This is one of the things that we're seeing. We're seeing that people are exercising less. I know I'm certainly exercising less. That low exercise does cause people to have some sleep issues, does cause people to have some anxiety and depression issues. And so the mental health issues associated with this are starting to get severe. So if you can go to the gym, I strongly recommend it. Okay, again, so if you are from Douglas County or know somebody from Douglas County and are be part of this, then please go ahead and start your little thing with a little comment about Douglas County. So the ones we've had is, I like Sherms, I like Wildlife Safari, I like the half shell, all those kind of things that would tell me that you're here and not some sort of foreign person who's trying to get that. And also I want to just hear what people think. So what do I think? So Zach says, what do I think about relief nurseries opening up? Similarly with K3 or preschool, I think those are probably going to be safe to do. Again, you want to use small cohorts. You want to exclude people who are sick. You want to exclude people who have recently traveled. But I think otherwise it can be pretty safe. Yeah, so is Rite Aid testing reporting to the county and state for numbers? I actually talked to the person in New Jersey who ran that program, and they said that they were. We haven't seen them yet, but they said that they were. and we're going to check again on Monday to be sure that it really is coming through. The state has a very, 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 very nice way of reporting data. So it's a thing called an electronic lab report. Most of the labs in the state and the country are on these labs, and what they do is they submit a report, and within a few microseconds it gets into there, and we get it within just a few minutes. And so it's a great, great system. Some of the new labs that typically have not worked in Oregon have not reported to the Oregon lab, and that's some of the issues. So again, the VA is not always reporting this Rite Aid, so we may be actually undercounting the number of tests. We think, however, if they have a positive test, that they will report those, but it's undercutting our number of negative tests, which is a problem because, remember, test positivity is one of the things that will allow the schools to open. Now, our county rate is low, but at the state, if they're not receiving 5 or 10% of the tests, that's enough to bring that state positivity rate from 5.4 down to a lower number that would allow schools to open. So Rite Aid and everybody else, please, please, please report. Okay, well, a couple of more things that I read this week. We talked about Sweden. So Sweden is a country, Scandinavia, and Finland, Sweden, Norway. And they've taken slightly different approaches. Finland and Norway took a much stricter lockdown approach. Sweden took a more laissez-faire approach, although not super laissez-faire. I mean, they did do stuff with schools and they did do stuff with businesses, but much less of a strict lockdown than Norway and Finland. So in the end, we'll talk about cases per million. So Finland had 1,400, Norway had 1,800, and Sweden had 8,300. So they had about five. So Sweden had about 5 times as many cases, and about 10. And for deaths, Finland had 60 deaths per million, Norway had 47 deaths per million, and Sweden had 571 deaths per million. So they had about 500 extra deaths per million compared to Norway and Finland. And what showed up on that? Well, they all had poor economic performance. Sweden's economic performance was about 5% better than Norway and Finland. And that's why this is so really complicated, because the more restrictions we do, the less disease we'll have, but the more economic hardship will cause. And so we have a natural study here about what happens when you do less. You do less, your economy does better, but you have more deaths. And that balance of what's a death worth, I don't really know. And that's why I think we need to think about this as a country and see. Because there are some who said, well, we should just in Douglas County let it burn through, have that same kind of death thing that Sweden had, which in Douglas County would be about 60 deaths over the space of 4 months. That would be hard. I think that would be hard, but that's the economic calculus you do. And I'm never going to say that Sweden was wrong or Norway was wrong or whatever. It's just different ways to approach the same problem. And it's the value of money versus the value of lives, and people view those differently. Just like people view risk differently, I think people view these lives differently. Okay, I see we have another question here. Oh, no Snowmageddon. Yeah, I'll be happy. I will certainly be happy if we don't have to do that again. Property that we were living on had a lot of madrone trees, and I think it snapped branches off almost every madrone tree. So if the state isn't below 5%, can schools start here? So again, there's K3. So K3 is not dependent upon the state rate. So K3 could open. Small rural districts, small rural and remote districts, not related to the state rate, so they could open. But 412 in the big districts here, Roseburg, Sutherland, and such, can't open unless the state rate is less than 5%. But I think the state rate is going to get less than 5% this week. I will predict that it's less than 5% this week. So somebody says, like the VA. So I saw New Zealand went over 100 days and then new cases. What happened? Yeah, they don't know. They don't know where these new cases came from. They don't know if they were imported. One of the interesting things is that it may be in animals. So one of the things that we've seen with this virus is that animals, especially cats, can get the virus. They don't get very sick, but they can carry the virus and then presumably bring it to people. And so there's some worry that there were intermediate animal vectors. Could be bats, but actually it's more likely to be cats because we have so much more contact with cats, that cats may have been spreading this around and then a person got it again from a cat. So we don't know, but New Zealand. But again, this is a big country, bigger than Oregon, who go 100 days without a case and then have 4 cases. And then, because they only have 4 cases, it's tremendous investigation to where they come from. And this is what the problem, and this is illustrative of a problem. So what's happening is that in areas that have brought their case lower, they can really focus on the cases that are out there, like in Douglas County, like in places in the Northeast. In places like Texas, where there are so many cases, you can't even begin to try and figure out where these cases come from or to try and control it. But New Zealand, because their cases are so low, they can do it. Old soul pizza, right? Very good. So what's your comfort with UCC returning as opposed to high school and elementary? Well, let me talk about sort of as grades go up. So if you have a K3 class, you could imagine a second grade class, there would be 15 kids in the class, a teacher and an aide. Those kids could all go to school together, they could have lunch together, they go on the playground together, and really not have a lot of contact with other people. And their risk is pretty low. When you start getting to middle school and high school, where you start changing classes, and now you're in multiple groups, it gets much higher. But now when you get to college, where not only do you have multiple groups and multiple things, you do things that people do in college. They go to dances, they go to parties, they go to fraternity things. And so I worry that as we get higher and higher in grades, this is going to be less and less tenable. I really, really, really worry about U of O. I mean, they're planning on bringing some students back. That's going to be a problem. And I really worry about some of the schools in the Southeast. There's a lot of disease out there already, and they're talking about bringing the schools back. I'm really afraid that that's going to bring up the number of cases. So somebody says they love Crater Lake. How could you not like Crater Lake? Crater Lake is really so amazing. You know, one of the most amazing places in the whole world, and it's right here. So where are we as far as developing a vaccine? So the story is there are hundreds of vaccines out there that people are trying. Some of these are really interesting. The Chinese vaccine is an inactivated virus. So what you do is you take the virus and you tweak it so it's no longer infectious. So inactivated viruses are things like we use for polio. The Moderna one is an mRNA vaccine. And the way that works is it gives this messenger RNA that gets into your cells, tells your cells to make the protein, then your body makes an antibody against the protein. So much, much, much higher tech than the Chinese approach. There's another one where they take the spike protein and put it in nanoparticles. There are a couple of vaccines that are in phase 3 trials. Phase 3 trials, they typically have tens of thousands of people in there, and they're looking for unusual side effects, and they're looking for effectiveness, right? Because once you get 10,000 or more people, some of those people will be exposed. And what you're hoping to see is that the people who got the vaccine get the disease at a much lower rate than those people who did not get the vaccine. And so that's where we are on phase 3 trials. That country east of Europe tried one, and they came out. I've not been able to find any details about what that virus is, and they've really done only the equivalent to phase 1 studies, just a few people. And I know the guy who's in that country east of Europe said his daughter took it. But again, you really need to try this out on many thousands of people before you can be sure it's safe. Yeah. So Cameron says, reporting and tallying presumptive cases seems wrong. Why don't you take them off the count if they test negative? And again, this is what we do with every disease. So I gave the example. Mom brings the 3 kids in. They have, the first one has strep. Second one has exactly the same things. Their strep test is negative. Are we really going to say that that second kid doesn't have strep? No, we're going to think he has strep and treat him as if he has strep. And then we don't even usually test them. Again, presumptive cases are people who are close contacts. This is not like, oh, I was just in Walmart with somebody. This is a household contact or a close contact of somebody was there, and they have symptoms which are very suggestive of COVID, and either don't get a test or test negative. There's a lot of controversy about whether you should take them off. Really, in the end, doesn't change very much. If I said we had 144 cases or 150 cases, does it really make a difference? No. And since it really doesn't make a difference, we do this like we do all other diseases and consider presumptive cases to be cases. Now, we could argue this, and I've argued this with a bunch of people over the last few weeks, and I have to tell you a story. So I was in the Navy, and as you could imagine, I was probably a little controversial. And so when I went to officer candidate school, I thought this was sort of the debating society, so they talk about Navy rules, and I would ask, well, why do we do that? How come we don't do it this way? Wouldn't it make more sense if we did this? And after about a week, they decided that, Bob, this isn't a debating society. We're telling you how the rules work, and some of it is this. So we could debate the pros and cons of considering or not. Now, I've done the math. Because the false negatives are so high in this disease, somebody who had the presumptive symptoms and one negative test may actually really have the disease. So there's different ways to do it, but I think in the end it doesn't really add much. Now, if we had one confirmed and 159 presumptives, you'd say, well, that's something funny going on here. But when almost 90% of our cases are confirmed, and when we look back before this last week, of the ones that were presumptive, the ones that could test, almost all were positive. So you got to do it one way, right? If you say presumptives are negative when they have a negative test, it's just you got to do it one way or another. Okay, so Sandra likes Cooper Creek. I do too. Especially love the trail that goes around that. That is one of the nicest trails ever. Unfortunately, it's pretty steep. So Sandra says, is it too early to get the flu vaccine, or should I wait? Well, the good news is this year we expect to have lots of flu vaccine. We expect the flu vaccine to be a good match for the flu viruses out there. We don't know about what the flu season is going to be. It could be a quiet season because people are doing a better job of distancing and wearing masks and whatever else. The optimal time to get the flu vaccine is 2 months before the flu hits. Since you never know when the flu is going to hit, getting the vaccine now would be okay. The vaccine effectiveness goes down a few months later. So I was on a talk yesterday about doing it. The answer is the best time to get the flu vaccine is the day you get it. So it would be okay to get it. So this person likes the North Home Trail. Isn't that incredible? So we knew somebody who was coming from somewhere else in the Forest Service, and they said the North Home Trail is like the best trail anywhere in the country, and they vied to come here in Douglas County because it's such a great trail. So what's the protocol for cleaning masks and shields? So masks, this one I think is washable, but typically the cloth masks are washable, and you just need to wash them in a regular wash cycle. For shields, they should be cleaned with a dilute bleach solution or other antiseptic solution. So when we do our drive-thrus and whatever, we use these shields, we clean them off with a dilute bleach solution. So Ashley says, will I stop spreading fear and start telling the truth? Well, Ashley, please put in a comment, a truth about what? I think we're not spreading fear at all. I think mostly what I said today was good news. And if you have some specific thing that you'd like me to tell the truth about, please put it in there, because I have no vested interest in any of these things, and I think I've told exactly the truth. So if you can pick one area where you think I could tell the truth a little bit better, let us know. And we'll be waiting for your comment here about what you want us to tell the truth about. Okay, a couple of other things that we've seen in this last week. One was about this Governor DeWine. So Governor DeWine, governor from Ohio, went to the White House, was going to visit the president, and had a test. He had an antigen test. The antigen test was positive, so he couldn't do the president, but then he had subsequent nucleic acid tests that were negative. The question is, what's going on there? We do not know. So these antigen tests look for the protein that's in it, and they're good because they're fast. So 15 minutes you get the result. But we've seen some false positives. That is, people who are not symptomatic got tested and they were positive, and then you did the ones that were negative. So hard to know what to make of those. Actually, the company that makes it very clearly says that these are not to be used for asymptomatic people. And so I'm not sure why they used that test on this guy, because the test is not specific enough, I think, to use for asymptomatic testing. But they did it anyway. Okay. So one of the questions is, so this person likes Myrtle Creek Festival, I do too. So will the flu season be better because of all of the mask wearing? We certainly hope so, because we think that flu and coronavirus spread in sort of similar ways. Respiratory droplets, close contact, maybe hands and then to face. And because of that, we would hope, as people wear more masks, as they do better social distancing, that this could be a good flu year. The other thing is there's plenty of flu vaccine this year. They doubled the production of flu vaccine. And so we're going to be starting to do flu drive-thrus in the next few weeks. And as we do that, we're really, 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 really hoping that everybody gets a flu shot. All right, I see one more question coming. So if somebody says they're experiencing normal flu symptoms, is it COVID? So if the normal flu symptoms are fever, headache, sore throat, and cough, and so could it be COVID? Absolutely. And that's one of the reasons we worry about this fall, because the symptoms of COVID and the symptoms of flu are not that easy to separate. Again, fever, cough, sore throat, and headache are typical symptoms for flu, but they can also be typical for COVID. And the problem is going to be somebody's going to come in the office and they say, Doc, I have those symptoms. Well, last year, before COVID was there, it was easy. You did a flu test, and if the flu test was positive, then you knew they had flu. If the flu test was negative, then you knew pretty well that they didn't have flu. You didn't have a great example of what they had. But now, if they come in and you do a test and it's negative for flu or even positive for flu, do they also have COVID? It is going to be so hard to know. And that's why we really want to drive this disease down so that there's not a lot of COVID going around at a time when flu does come around. So is flu vaccine readily available yet? This is backwards, but it arrives at the pharmacies before it arrives anywhere else. And I saw one pharmacy in town this week that had it. I don't want to speak which one it is, but one pharmacy already had it. My son already got his, so there is some flu vaccine already available. The flu that comes to doctor's offices and clinics is behind what comes to the pharmacies, which doesn't seem right, but it is the way it is. But we expect to be getting it in September, so that's right around the corner. Ashley, don't be shy. Tell us what we need to tell the truth about. Because if there's something we want to tell the truth about, we'll be doing it. Again, I think we're not spreading fear. I think we spread some good news today. The good news is that the disease is down. The good news is that schools may be able to open. The good news is that most of these have been tried to travel, so they are fixable. Right? So if a lot of the cases people said, I don't even know where I got it from, that would be hard because it would be hard to know what to avoid. In this case, since so many are tried to travel, we know what to avoid, which is if you do travel, quarantine when you get back. Don't go right back to work, because when you go right back to work, you can expose others. All right, so there's two more things I want to talk about, and if we don't have anything else, and Ashley, get your chance here. One was about the alternative medicine thing. So we reviewed that a little bit last time. It got a little bit shouted out by this, but this was a study that looked at a case series of practice in Michigan, did a retrospective review of the patients that they saw who they thought had COVID. Only about 25% of them had tests, so they weren't sure about the others. They treated them with a bunch of things, including vitamin A, vitamin C, vitamin D, oral iodine, nebulized hydrogen peroxide, and IM ozone. And of those, 3 were hospitalized, 2 actually before the study, but 3 were hospitalized and there were no deaths. And so that's reasonable. The people who wrote the study said, okay, now we've shown that this could be used. It might be helpful, and they recommended a trial. Certainly would recommend that we do that. Highway 42 makes me car sick. Wow, that is quite the road, isn't it? That's an amazing road. So have we been able to ramp up testing and decrease time to process? So yes. So as I said earlier today, that there was a time we were like 10, 14 days out for test results. All the tests we did on Tuesday were back this morning. Yes. All the tests I did last Saturday were back by Monday. So the turnaround time has gotten much better. We have lots of testing materials available. So again, anybody who thinks they have the disease should certainly get tested. Now, one of the questions about testing prior to travel. So some states decided some states initially did this where you needed to have quarantine for 2 weeks. And Alaska and Hawaii did this. They had very, very, very low rates of disease. They got a lot of pressure to allow testing instead of quarantine. And so if you got a negative test, you could come into the country. It has been disastrous for both Alaska and Hawaii. So both Alaska and Hawaii have seen a huge increase in the number of cases related to that. And again, when we look at our travel cases, that is, again, not surprising. Most people have relatively short trips. They have these short trips, they get infected, say, on a Thursday, and they travel on a Saturday. The test is not going to be positive on the Saturday, but the person is now going to become infectious on Monday or Tuesday. So they did everything right. They got a test on Thursday, it was negative. They travel over the weekend, Monday or Tuesday, they're infectious and they bring the disease. So they got a false sense of security that they were negative at a time that they were positive. So again, I know there's some states that are recommending testing before travel. That hasn't really worked out. But you remember starting weeks and weeks and months ago, I said what I wanted for Christmas this next year is a spit test where you could get tested fairly accurately and very easily and fairly cheaply every day. And so I envisioned back then a little shot glass you could spit in, take a shower, and we'll get out, tell if it's positive. Well, it turns out that we're very close to that. I'm sure it wasn't because of me asking for it, but there are 3 companies now that are coming out with a spit test, and apparently there's one for sale in Europe where you do just that. You basically spit in a little thing, and you'll know the results fairly soon. U of O is trying to do one where you can spit and actually have a bunch of spit collections pooled, and then get the results within an hour or so. And then if any of those are positive, the whole pool turns positive, and then you can test the individuals. Think about a football team who would, before practice, each give a saliva sample. You test it while they were in practice, and by the end of practice, you could say everybody was negative, you're good to go, or one of you guys was positive, we're going to test everybody individually. But again, a spit specimen is pretty easy to give, and then you would be able to figure out who on the team had it. I think that kind of testing is going to be much better. Ashley? All right, well, Ashley, you know our Facebook address. Really, if you have something you want us to tell the truth about, we'll do it. Or if you think there's something that I have unreasonably instilled fear about people, please let us know, and we'll answer you. Otherwise, it looks like we're good for tonight. Did we get bombed?
Yes.
Oh, we did. Oh, well, this happened. But we'll see what happened. And thank you for all these great comments about Douglas County. I think you picked out many of my favorite things in Douglas County. We'll try something else next week to see if we can defeat the intruders. Again, this is Dr. Bob Dannenhoffer, Douglas County Public Health Officer. Thanks.